Stand for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Looking for approval of the minutes for the Health Committee's regular meeting for February 4th.
So moved.
Second.
All in favor?
Aye.
Opposed? Carries. Resolution authorizing Health Department environmental fee schedule. I know that we did this last month, and then on the appeal for
Well,
you
gotta be on the right one. Additional hours?
No, I got it right here.
I'm looking at, what am I looking at here?
Budget modification
April
to
1st.
increase healthy families.
Yeah, healthy families.
You're on March.
Now, why do I have February?
Because you should have all the months in there.
April Fool's tells me how those donuts, huh?
Resolution budget mod to increase healthy families additional hours.
I'll move it.
Second.
And
Motion to discuss.
There was 2 vacancies. They have since been filled. We had 1 staff member start yesterday, and the next start in 2 weeks. So exciting news there. That program will be full of staff.
How long does it take to train these people?
A long time. It's a very intensive program. Months.
Months?
That's good. To get them up and running. So the 5,000 will help, but the team's been doing really good with minimal, if any, kind of extra,
It's fine.
just in case.
You're fully staffed now?
Well, I will be in 2 weeks, yeah.
2 weeks?
Good
Good
stuff.
job.
Yes.
So how's that program doing? I mean, we started this quite a long time ago, and we did it with grant funding in the beginning. This was sort of an offshoot of the anti-poverty task force at the beginning, yeah. And,
The program's amazing, and it's expanding. We got the new CW grant, which is the Child Welfare Protocol grant. Now it's completely funded, which is wonderful.
Great.
And we're up and running.
What is it?
I can tell you how many families we have right now. We've come a long way with this program, where it was ready to hang up our dancing shoes, to now that we have a waiting list to get into the program.
Excellent.
So how many people can we put in there, or how many families?
We can go up to 40 families now. I want to say 38, 40 families. As soon as everybody's up and running, we will have that many. Right now, I believe we're in the 20s, but I'm missing 2 staff. So. And this is a brand new program. The CWP program is brand new.
All right, I don't want to be totally naive, but I'm just a poor farm boy. I don't know. What do they teach? What do you guys do?
So this is a program from Prevent Child Abuse. We go in newborn to pregnant women, and we're just talking about how to care for babies and what it looks like. And it's okay not to have certain money, and how to do it without certain aspects. And like, we also promote education and going back to school and getting your driver's license and why that's all important. We motivate the parent to do those things, to be able. So we are helping them. We're not doing it for them.
Okay, so you're encouraging them along and like that.
We are.
And this is just for the mother?
No, it's the whole family.
Okay, now,
And so we do get, we have dads too.
all right, are many of these young ladies that are expecting or whatever,
And have babies.
and have babies? I
They
get
go
it.
up to 5 years
I
old.
get it. Is there the component of this, excuse me, rephrase that, the father of that child?
Yes, absolutely. Yes, the father is we always involve the father.
Always.
Always.
All right,
If
so-
there is one that is involved with the child, then the father is involved. Yes.
All right. And he is encouraged to help support that child.
Absolutely. And sometimes it's only the dad.
I'm sorry.
Sometimes it's only the father that is taken care of and is in the main role of caring for the child.
Well, what is a mother's responsibility as far as
Same as the
financial and
father.
everything else?
Yeah, same as dad.
Okay, I just want to make sure because we got way too many, and it's not just here, it's all over.
Not as many as we used to, single parent households.
Okay,
Our numbers are on our way back up.
And on the idea of numbers, I know when we first got into this program, we first started trying to fund it, we were like 62 out of 62 counties
That's
for,
correct. Public health rankings.
for this particular, for maltreatment and abuse.
Yes. Okay,
And recidivism. Where are we now?
I will have to get that number for you, but with the public health rankings, our numbers have been doing much better
Good.
over the last 10 years.
I knew they were, but I hoped that, yeah.
I don't have the exact number on me.
But in that particular category, that would be
You
nice.
better.
Actually, some of those, when on the Human Services Committee, they did start to share, at least quarterly, some of those reports that would come, where we stand for different health measures. If that would probably be something that'd be worthwhile to share with this committee when you get them too. I
Okay.
mean, especially if
The new ones just came out, actually.
I mean, it's can be eye-opening, and it helps to identify places we should be investing in or working on.
Absolutely.
Thank you.
You're welcome.
Legislature.
All right, I'm gonna just jump ahead a little bit on you and go to your report here, the Professional Advisory Committee report.
Yeah.
On the first page, as you turn it over, it talks about healthy families.
Yes.
ASR statistics.
Mhm.
Just can you explain to me exactly what that is? I mean, successful level changes 46, graduates from the program 3, non-graduate discharges 5, referral to other services.
Yes, this is from back in December, but yeah.
Just
Sorry,
I'm just trying to
numbers are
figure out what
different.
all this stuff means. Yeah, I don't care about that. I'm trying to figure out. Just curious, because you were talking about it and I remembered reading it here and I said, let me take a look and see what some of this stuff means.
is that the third paragraph kind of, or
Yeah.
subheading?
Yeah,
The
when
third,
it says healthy families.
Healthy families, AR or ASR statistics, Betty Dunsmore.
Mhm.
Correct.
oh,
That's Betty Dunsmore.
Debbie is the program manager
Okay.
of our Healthy Families program, and she'd be more than happy to come and do a presentation with this board if that's something that you want. 51 families served, that's within the first quarter. 19 were enrolled in the program. 845 home visits were made by our staff. The 2,134 phone calls or texts. We had, so there's 3 levels within the Healthy Families program, and we had 46 level changes. That means they were getting closer to graduation. You start with step 1. It's a very intensive program where you're receiving home visits every single week. We're in the homes of the families. Then they go to step 2, which they don't need weekly visits anymore, and we're doing visits a couple times a month at that point. And then they get to the point where they go to level 3, and then we're doing 1 visit a month, checking in, seeing if they need anything, any assistance, how they're doing, and then they go to the graduation when the child turns 5. We had 3 graduates and then 5 non-graduates that discharged because it is a voluntary program. So we've had 5 families say that they don't want to do the program anymore.
Okay, that's what that means then. Okay.
Yes, sorry. And then we've made 596 referrals to other services. That means we could have hooked them up with the diaper bank or any kind of referral within the OCO, a referral to DSS for services.
Okay, thank you.
You're welcome.
Legislature.
So, yeah, this was always seen as a preventative program.
I did.
A program where if we have interventions, at their time of their life, even before they get into school, the idea is it's a 18-year plan, if you want to have a kid be successful by the time they get out of high school, you got to start when they're young. And was one of the things, what Broadwell was saying at our no, I know we're not supposed to talk about caucus, but he sent us a piece that was actually from the CZB, leader that led that whole anti-poverty task force. And it's like, how do you stop it at the beginning? You know, the babies are falling off, the analogy was the babies are falling off the waterfall and we're picking them up at the bottom. How do we stop them from falling off the waterfall? And so this was we saw this right from the beginning as an important program. I'm glad to see that we've taken it as far as we have, and it's been funded. It's one of those preventive programs that I think can be really useful.
And it has been, and our data has shown that it is working.
The interesting part is you help them get licenses. In the last couple of years, I don't know how many 21, 22-year-olds are still living with mom and dad and don't have a
Their
credit.
driver's license, graduating from high school, GED programs, we help them get enrolled in all those.
Legislative process.
So I work in a backup program to that once everything falls apart and they end up in front of a judge, the judge takes the children away, puts them in foster homes. And then if they want to reunite that family under court order, they come to Family Time Services. And I went through 3 months of training every day and just got handed my first 5 cases of putting families back together. So these are the families that most of them choose not to use the program.
It is voluntary.
And then trouble with that, either assault on the child or neglect or something like that. The court gets involved, kids go to foster home, putting them back together goes to what we do. And from that point is either they have changed their skills and everything's working. It's an 18-month program. It does it once a week. Half hour with the parent, 2 hours with the family, half hour with the parents, how the visit went. At the end of that, the court then decides kids can go back home or kids will be put up for adoption. They don't remain in foster care after that.
So this really doesn't involve human services as far as
Yeah,
ASS.
that's a good point because they interact with each other. They have to.
Yeah.
Through the
I would imagine
CWP,
most-
yes,
Yeah, they do.
we do.
I would
For
say
our program,
we
they
share
do.
information. Like we are home visits.
Absolutely.
You got to share that information.
Absolutely. Every child that's from our CWP program is open with DSS, Child Protective.
Very good. Did not know that. Great.
That's why I wanted to talk about it a little bit. It's actually something I knew about.
Good conversation. Anybody else? All in favor?
Aye.
Opposed? Motion carries.
Thank you.
HE2, resolution authorizing environmental fee schedule update and budget modification due to the reduction in grant funding.
Make a motion.
Second.
Open for discussion.
There was some question about, what county was added.
Okay.
This is what we believe, is that Saratoga County, which is already a county, and I said that a new county was added. I believe they were added to full service, which includes an environmental program, which makes them full service. So, with that being said, I did print off what counties, if they did get a decrease in funding. Our funding was extremely high, in my opinion, $21,000 we lost out of this program. Some counties only lost a couple hundred. Some counties had an increase. If you want to take a look at that, I'm more than happy to share the information with you.
We got two.
Yeah, I didn't.
I can make copies.
I didn't print for everybody. Oh.
Well, this chart shows what the addition of this new full-service county
Did to the rest of the county.
to the rest of the other counties, and is there any rationale that you see behind it? Or
No.
does it look arbitrary?
Arbitrary.
And we got hit worse?
We did. We're like we're top 5 of how much that we gave up.
Were we receiving disproportionately high to begin with?
I don't think so, because we used it all. So Jen, would you want to step in? You had a good, because I questioned that, and she was like, it could be because of.
What was the reason for decrease on it for us? I mean, our poverty level seems to be increasing. According to what we're paying in social services, it's going up. And people are moving out, and we are losing population, though we did gain 1,000 since the year before.
Yeah.
And apparently, they must be all poor. I don't get it, because I'll tell you right now, my career took me down to the Tri-City area, and I lived in Saratoga County for 16 years. And I'll tell you, that county's got more money than God. Trust me, they do. I don't get it, because they have very small pockets of the total number of people there on social services wouldn't even fill half a full, for God's sake.
When we had same.
So I don't get it. I don't know what the reason is, sir.
I don't either.
So as a result, we're raising our fees $5, right, per.
We are. There was a couple free services that we would do, individual water tests. It's not, we never promoted it, but if someone called and said, is there testing available, we would do a free service. Now we added that to the fee schedule, and we're just charging them what it would cost us for a full panel compared to a partial panel for water testing.
So-
And then we did get rid of some non-mandated expenses.
What does the free test cost now?
$150, and that's what it would cost us to send it for testing,
That's a
or
big jump up.
$75 for partial. We still do the walk-in water testing. That has never changed. We still do that. And
Yeah, but
then
those are municipalities usually, isn't it?
the well waters. For the well water, we usually do.
We
We can do anybody's water, to be honest with you, if they think there's an issue out of the tap. But it's usually people with well water that bring it in to make sure that it's drinkable, potable.
Well, a lot of us on wells wouldn't dare to do that, because in fact, you gotta have water.
That is true. And we just give suggestions like treat with chlorine, usually that will fix most issues with wells, or boil water. And then we did add $5 across the board. Thank you.
Anybody else? All in favor?
Aye.
Opposed? Motion carries. HE3, resolution appointing members to the Seward County Traffic Safety Board.
Make the motion.
Second? Second. Open for discussion.
And this is appointing Sergeant Joseph Taylor, due to a resignation of another member. And
He retired, correct?
Yeah.
He retired, that's my-
And he comes highly recommended. He is supervisor of the anti-crime team. And he's also involved with other traffic safety projects.
Question? All in favor?
Aye.
Opposed? Motion carries. Committee review and decision, December professional tech minutes.
December, the fourth quarter, 24, PAC. A review and approval. And
So a question came up at one of our meetings, the acronyms. Could we get like
Yes,
a
yes,
breakdown
yes,
of the
I'm so
acronyms
sorry.
along with the, because it is, when you're in the field, they all seem to make sense, but when you're on the outside looking in, we have no idea what PTC, PCA means in the health department,
like, yes, absolutely.
To me, PCA means Packaging Corporation of America, right? So, I don't know.
Absolutely.
Next time it would be great to see that. I'm okay with approving that.
Just to let you know, that went on to the DEP committee, I brought it up. Went on to say,
Okay.
and these figures that you've got that are all zeros, apparently there was an error, so it ended up coming up all zero.
or even you have a, oh, yeah,
We have
right.
to vote to accept the fact?
Pardon?
We have to vote to accept the fact?
No.
No, okay.
Anybody else?
You got a motion to pass approval of the,
As long as
because you
you're-
said you didn't have a quorum the first one.
Yes, I just need approval.
So
They
you
need a motion,
need a motion to approve these.
need a motion to approve.
I'll make the motion to approve the minutes.
Second.
All in favor?
Aye.
Opposed?
Thank you.
I thought you meant the packet. I
No.
thought you meant the financial.
No,
Oh,
well, we went out to financial before we.
But I have a couple things.
Yeah, because everyone, the flu's supposed to be flying out here, not struck through, I like that stuff.
Yes, that's what was on the rise. Blue numbers are actually. I do have a couple of discussions.
Go ahead.
So the first week in April 7th through 13th is National Public Health Week. This is our 30th year. We were invited by Mayor Rice to receive a proclamation tonight at his council meeting. And we're also going to do a proclamation at our legislative meeting on the 10th. Do you want me to go through some of the events that we're doing? So on Tuesday, April 8th, we're doing Bite Back with Cancer, and we're going to have the upstate mammogram at the health department to do mammogram. On Thursday, we're doing free CPR training at the health department with our health educators. That class filled up really fast. A lot of people are interested in CPR. Thursday, April 10th, we're doing a mental health art show, and that's unmasked at the art scene at CNY Art in Fulton. We had a art teacher from Hannibal High School get her students involved, and we had like 40 submissions this year, which is amazing. Yeah. And then on Tuesday, April 15th, we are doing a Kids Day. We usually hold most of these events right at the health department, but since we're under construction, we had to go off-site this year. We're doing a kids' beach party at Kid Charities. I know it's not during Public Health Week, but it's when kids are on spring break. Usually,
There you go.
Public Health Week falls
Yep.
during spring break. This year it didn't. It was like a week before. So that's just some of the things that are going on at the health department. Another thing is I wanted to discuss with this team about our overdose fatality review team, if you don't mind. So we've been running a public health and safety team with injection with our public health, our safety officer and our HIDA officer. And an offshoot of the FAST team, which is Public Health and Safety, is our Overdose Fatality Review Team. So New York State right now, I don't have access to any death certificates or any data that has to do with an individual case. And it's hard to study a case if you don't have that information. So an idea came up that maybe we could put out a press release, and this, I want to leave this up to this team to discuss this. Put out a press release to talk about what the public health and safety team is doing and what the OFR is doing, and put out a call to action to our residents and ask if anybody is willing to come forward with some information, maybe about a loved one that they have lost to an overdose. By doing that, it will give us information. It's not going to give us everything we need, but I think it will get us started. So this is in assembly, which is wonderful. I did make a couple copies of this also. Rich Mitchell sent this to me. This is a proposed law for New York State saying that the Commissioner of Health can designate local health department leads to request certain information, because right now we can't. Like reports like the death certificate, the toxicology report, the autopsy report, information that we don't have. So I think that's kind of neat that they recognize that health departments want to review overdose data, kind of like we do the child fatality review board. We just don't have the information to be able to do that. So hopefully this will change soon, and then we'll have a full picture. But right now, I would like to reach out to our residents and say, does anyone want to share their story with the health department so we can look at this information? And maybe we can save lives and learn from it and move forward.
What's the hold up of why you can't get this information?
It's against public health law, you can't. I've had,
Ask for it voluntarily.
It's a problem that we can't get information.
through the press release, it will be volunteer basis only.
All right, and if we do it, that press release, I would think would need some statements in there reassuring people that will be treated as public, as protected health information, not subject to FOIA.
No, not
We gotta
subject to
verify
FOIA.
that with Rich, that
Okay,
if we collect that data, to what extent can we protect it from disclosure?
because a lot of it's gonna be their own opinion.
Mhm.
So some of people might say, I have the toxicology report from when my loved one passed. They might share the death certificate with us. I don't know what we're gonna get, but I think absolutely it would be,
Well, what you're saying, Phil, is it to protect it from FOIA?
absolutely.
Is that maybe why they didn't share it before?
It's just part of public health law. I've had Christy even said, we had a tabletop, last summer. And we had all our partners at the meeting, including New York State Department of Health, that, made this scenario up, and we formed the scenario around our county. So we invited our partners from the emergency department, our HIDA officer, our law enforcement. And I think the tabletop went wonderful. We just need to continue to do that and look at information.
Right.
But I can't do that until the law passes,
Yeah.
or if it's a voluntary from our public.
Saying,
I would say that let's hold off till the next meeting so that we can research this a little bit and let Phil do a little checking with NICEC, and maybe we can
Okay.
send a resolution to the state in support of this if it all falls out within the purview of the law.
Absolutely.
So, yeah, I think we could just bring it back up next meeting. Okay.
Because part of the public health, part of the OFR is a next of kin interviewer, which is a professional that has a conversation with the next of kin.
Just around the corner here.
Richard,
Jimmy, you're on the state,
It's a
and I said,
resolution
Public health, mental health.
for
Pardon me?
Thursday.
Public health, mental health.
why can't we, the counties need this information, why can't they leverage this out?
We could push it through that.
Because this is important, you gotta know, you can't solve a problem unless you know what it is.
We can,
Jim, do you recall if it was a NICEC resolution this last time
No.
through the health committees then?
no, that was not this last time.
Okay.
But we can put that together. Gregory's told me 2 or 3 times, anything you want, just give me a call.
Okay.
But they put together the vaping thing, and now they got a challenge back from NICEC that said, we want to know the disposal process, what it costs,
Mhm.
and in law, who's going to pay that. So I know that you've got somebody working 24/7 on that.
We do, and we'd like to put the cost back to the vape shop.
Absolutely. But there's nothing that says we can even do that
No,
in law.
not yet.
Is your association aware of this? Have they taken a position on it yet?
Some of the counties already conduct full OFRs, and they just,
Is the Do
get
it.
the information from the coroner. Our being said, just because other counties are doing it, doesn't make
It's
it
legal.
legal. So, some counties are functioning full OFRs, we just are not right now.
OFR stands for,
Overdose fatality review, kind of like the child fatality
Okay.
review. We're just not protected under the same law yet.
I'll give them notice that we're gonna do something with this, send this to him.
okay.
But the child fatality reviews, they've been putting out public on their websites.
That's under public health law that they have access to that information. We do not for an overdose. We agree. We need that information.
Interesting. And that, because that's disturbing, I mean, because, that, those people end up, getting vilified on Facebook and social media, and it can be a danger to their families.
Interesting
Just want to make sure
conversation.
there's gaps in service.
Good conversations. And I remember when I started out as a legislator, my daughter kind of schooled me in a book of acronyms. She said that you're absolutely insane. And it seems like we get more acronyms every day. So, all right. Anybody else? Yeah, motion to adjourn.
So moved. Second.
All in favor? Opposed?
Thank you.
Motion carries.
Thank you.